This is a checkoff for the 840 ventilator using the initiation of continuous mechanical ventilation found on page 575. So first off, what you want to do is obtain the physician order and scan the chart. The order may include all the ventilator parameters that you need, or you may have to calculate some of the parameters yourself using the patient's ideal body weight, the previous FiO2s, and your basic understanding of mechanical ventilation. In some hospitals, you, the respiratory therapist, will determine all the major parameters and alarm settings for the mechanical ventilator. Once you've scanned the chart and have a better idea of what the patient needs to be on and why they're going on the mechanical ventilator, then you want to gather your equipment: a stethoscope, a ventilator tubing, humidifier, a water system, any type of oximetry if it's not on, also cuff manometer, and other forms of testing equipment that is necessary prior to the patient going on, such as a respirometer to measure exhaled volumes. Next, you'll want to measure the mechanics of ventilation. These things are necessary in some patients to ensure you know what the patient needs and why they're going on a ventilator. Mechanics of ventilation would include NIF, tidal volume, minute volume, as well as vital capacity. Will you be doing this on every patient? Probably not, but some you will need to. Then you'll assess the oxygenation and cardiac status. Oxygenation can be done with oximetry and arterial blood gases, and with the cardiac status, you want to look at the cardiac monitors and see what the blood pressure, rhythms, and those things are being displayed. So next you'll set up the equipment. Make sure that you have your humidifier and water feed system. Connect that to the humidifier and attach your water bag. Your tubing from the ventilator to the humidifier, that includes a filter, and then the ventilator tubing itself, making sure that you set the thermometer port on the in-story tubing. And in this machine, you will want to make sure that you replace the disposable expiratory filter with a new one. Connect your expiratory line, and then you will go to the SST function of the ventilator, which is described in another section. So make sure that your gas pressure lines are connected, your power pressure is in the wall outlet. Turn the ventilator on, and after you've assured what the ventilator is, that you've done your tubing test, that it's functioning correctly, and you'll go into the ventilator, set a new patient, ideal body weight, and then set your parameters, making sure that you're consistent with what the physician has ordered or what you've determined is best. In this case, we'll go with SIMV, volume control mode with no pressure support. Turn the pressure support off, and we'll go with pressure triggering. Now from this point we can enter in the ordered rate. We'll go with a rate of 12 and a volume, and that will be based on your ideal body weight. Typically it's 5 to 8 mLs per kilogram. So if we're dealing with a patient that is 70 kilograms, that could be anywhere from 350 to 540, and so we'll take a tidal volume of 500 because this is going to be a large patient. Flow, we want to have our flow in an acceptable range. I'm going to go with 40 at this point. Pressure sensitivity, -2, and we've determined by way of the physician order that the FiO2 is to be 50. We want no PEEP, and we have the rise time, we'll turn that down to 20, and no plateau time. Square wave is fine, and our peak pressure is set at 40. We're happy with that. Now the ventilator is waiting to be connected to the patient. We've done our measurements. We've assessed the patient's rate, volumes, all of that earlier. And now we can connect the patient to the ventilator. The ventilator will start ventilating for the patient. We will then go into our alarm menu and readjust our alarms once the patient is on the ventilator, setting the high pressure alarm to 10 over the peak. In this case it would be 13 is the peak and the high would be 24. Our high rate, 10 over the patient's rate, is doing 20. And our minute volume should be 2 to 4 over the patient's minute volume and 2 to 4 under the patient's minute volume. Also the exhaled volume should be 100 to 200 greater than the patient's greater and less than that range on the patient's exhaled tidal volumes. And once we have those set, we can accept those. And then we'll want to draw arterial blood gases within a half hour after setup. We're going to clean up our area, wash our hands, and then before we leave the patient, we want to chart all of the information in the patient's ventilator record. That completes the initiation performance on the 840 Puritan Bennett ventilator. Thank you.